Hello, good afternoon, all. Welcome to my talk. I am Dr. Rachna Sharma, practicing in Mumbai, Mira Road for the past 28 years. I am attached to Wokhad Hospital and Dr. Fareed Hospital. So, welcome to my talk. And I would suggest the topic of my talk is such that if you attend it with your husband, that would be good because it needs assistance. So, my topic is such that I would advise you to hear it with your spouse. My topic today is about mental health during pregnancy. And it's a very important topic which is often ignored. Almost 30% of pregnant women they undergo anxiety and depression. Causes might be different. There are plenty of causes for anxiety and depression. Today's lifestyle, today's most of the women are working women today. So because of that, lot of stress at workplace, at home front, they have to balance everything. So today women are much more stressed as compared to our parents or our grandparents. So they have to balance so many things, they have to don so many hats. So lot of problems we ignore because in India it's a taboo to see a psychiatrist or a trained counselor. Most of the time symptoms are very mild which can be taken care of with the assistance of your family. But problem these days is because we are staying with nuclear families, mostly husband and wife are there, no elders are there at home to suggest them something during pregnancy, to guide them through pregnancy. So it becomes a bit difficult for nuclear family parents. Then there are plenty of pregnancy is a reason to rejoice. You should enjoy your pregnancy. But sometimes when it happens in some stressful condition, like your career is there, and suppose at home things are not very favorable for you, it might lead to anxiety and depression. There are so many hormonal changes in your body happening during pregnancy, physical as well as they affect you mentally also. So because of these changes, there are plenty of changes in your body which you face all of a sudden. There are so many changes in your body which might lead to anxiety. Why this is happening to me? Is it happening to me only, or everybody is suffering through it? So you start thinking like that. This is very common when you are getting pregnant for the first time. So first pregnancy is a new experience for everybody, and whatever is happening to you, it's so new and you are confused whether this is normal or not. So I would also advise you to get in touch with your doctor as soon as you miss your period. That is very important. So I want you to enjoy your pregnancy. It should not be a thing to be stressful, to take stress. So you should enjoy your pregnancy. It's a time to rejoice. Practically, it is seen that these symptoms are more common. Who is going to get these symptoms much? Not every woman is suffering from anxiety and depression. So why in some women it happens and why in some women it doesn't happen? So in which woman chances of getting anxiety or depression is more? So women who have past history of anxiety, some people they get anxious very soon, they are not that strong. So patients who have a history in the past also they have suffered with anxiety or depression, there are chances that they might suffer with this during pregnancy. Then if they have a family history, like if among their parents somebody suffers from this condition, like they get anxious or they are suffering with depression, then chances are more that those patients might suffer again. Then if there is addictions these days, with the like culture is such that youngsters they are used to drinking, cigarette smoking or drugs also. So if patients are used to that and when they get pregnant, and they have to leave all this, there might be withdrawal symptoms, and because of that, there might be depression and anxiety. Sometimes there is some trauma in the past, and because of that, you have suffered depression in the past. Then again, it might come because of hormonal imbalance during pregnancy, it might come back again during pregnancy. So these patients are more prone to get anxiety and depression, but others might also get it. There are so many reasons. You're not prepared for the pregnancy. Then again, there are chances that you might get. Then during first pregnancy, so many things, so many worries are there, whether everything is going to be normal or not. So because of that worry, you might get anxious whether baby is going to be normal or not, whether my pregnancy will end up in normal delivery or not. If family is big, then you are burdened with workload. So that again is a cause of stress. So what are the symptoms? How you will know that we are suffering from anxiety or depression? How you would get to know? Sometimes you don't get to know what's happening to me. You don't get to know why I'm behaving like this. So there are few symptoms which might lead you to think that, okay, you might be suffering from depression of pregnancy. So first of all is feeling an uncontrollable sense of anxiousness. At all times you feel anxious. There is no reason to feel anxious, but you are feeling anxious about something. Patients come to me and then say, there is no reason for me to feel anxious, but I'm anxious at all times. I'm hyperactive at all times. I keep sweating on my palms. I get sweating on my palms at all times. So why I'm feeling like this? There is no obvious reason to it. So this might be one of the symptoms. Then worrying excessively, excess worrying, like बेबी नॉर्मल होगा या नहीं होगा, वेदर मूवमेंट्स सब नॉर्मल होंगे या नहीं होंगे, मेरी नॉर्मल डिलीवरी होगी या नहीं होगी. एज आई टोल्ड यू, वरिंग एक्सेसिवली, there is no reason to worry. Whatever will happen for the best. So you have to wait till last whether it's a normal delivery or not. Everything is decided at the last moment, so you don't need to worry it since beginning. So worrying for everything, what will happen, that is one of the symptoms. Then inability to concentrate. You are a working woman, you go to the office, but you're not able to concentrate on your work. You feel distracted, your mind is not at one in your work. So that might again be one of the symptoms. Then insomnia is lack of sleep. You're not able to get a proper sleep. Just you keep tossing on the bed, you're not able to get enough sleep. You feel irritable all the times. You start shouting on very small petty issues. You start shouting, and husband bears the brunt of it, because sometimes without any reason you just start shouting on a very small thing. Or if you have children, then you start shouting on them, you start scolding them, start beating them. बहुत छोटी सी गलती के लिए आप उनको बहुत ज्यादा चिल्ला देते हैं, आप बहुत ज्यादा हाइपर हो जाते हैं. That is again a symptom that you might be suffering from pregnancy blues. Pregnancy blues might happen just after delivery. That is called as postpartum blues. But during pregnancy also you might suffer this. Then sometimes you feel breathless. All of a sudden you feel that you can't breathe. You have to take deep breaths. You feel that you're not able to breathe. You feel very congested in your chest. That is again a symptom of pregnancy. Then at all times negative thoughts cloud your mind. At all times you are thinking something bad will happen. No, baby will not be normal. No, something awful is going to happen. नहीं, कुछ अच्छा नहीं हो रहा है. नहीं, ऐसे नहीं होगा. Negative thoughts. You might be knowing that elders in our family, हमारे बड़े हमेशा हमें ऐसा बोलते हैं, when you are pregnant, be positive. बी पॉजिटिव, अच्छी चीजें सोचो, अच्छा खाओ, खुश रहो हमेशा. ये चीजें बोलते हैं हमेशा, बट दैट इज इजीली सेड देन डन. बिकॉज when a person is suffering from depression or anxiety, it's not in her hands. She doesn't do it deliberately. जानबूझ के ऐसा फील नहीं करते हैं, बट ऐसा कभी अपने आप से होता है ऐसा, because of hormonal imbalance and because of the past history maybe. सो बोलना आसान है ये चीजें, बट उसको करना थोड़ा सा डिफिकल्ट हो जाता है. तो ये सारे सिम्टम्स से आप ऐसा गैस कर सकते हैं कि आई माइट बी सफरिंग फ्रॉम डिप्रेशन, आई माइट need to see a doctor, I might need to see a counselor. Then when you are suffering with depression, what will be the effects on the baby? Because baby is going to suffer. You are carrying a baby. Whatever happens to you, it's going to have an impact on the baby. So because of depression, if you're not eating well, if you're not sleeping well, if you're not resting well, rest is also very important, then all this is going to affect your baby. Sometimes there are low birth weight babies, sometimes there are premature births. So babies are premature, they are born premature, then we have to them to NICU and other for further care. So all these things are like they have an impact on baby when you're suffering with depression. So you should not feel ashamed sharing your feelings with doctor. Of all, your companion is the best person to guide you and to reassure you and to help you, because he is there. Sometimes your husband is abroad, or if his work is like that he can't give you much time during the daytime, so you can talk to any close relative, any close friend, your neighbor or your doctor, that you're feeling like this. Telling your feeling, communication is the most important thing when you suffer with anxiety. So treatment and coping anxiety is in your hands to some extent. When it is a very mild variety, when it's a very mild, then you need not see a clinical therapist or psychiatrist. Only reassurance is good enough. Reassurance. But for that, you need to tell your feelings. You need to tell everything to your doctor. Don't shy away from saying things or asking things with your doctor. And then your partner, tell everything, whatever you are feeling. Don't be ashamed of that. So stop worrying. Mild cases usually they don't require any specific treatment, just they require some reassurance. Then support from family is very important. Sometimes if you are living in a big family, workload is so much, so everybody in the family should uh, divide the burden. It should not be on a lady who is carrying the baby. So workload should be divided. Sometimes because of workload, you feel anxious all the time, you feel tired all the time, so you get irritated. So moderate to severe variety, where there has been a past history of psychiatric treatment or treatment of depression, they might require a counselor or psychiatrist. So good outlet of your feelings is very important. First and foremost is talk about it to your partner, friend, and family member. I'm emphasizing on this thing a lot because many times it happens that you just keep bottling up your feelings. You just bottle up, आप अपने अंदर रखते जाते हैं, and one fine day you just break. So this should not happen. This nervous breakdown should not happen. It usually happens when you keep bottling up your feelings. You don't share about your feelings. That usually happen like when you do that. So simply sharing your thoughts and feelings may be good enough sometimes. You may not require any other treatment. Then engage yourself in some sort of hobby. Everybody has some interest or the other. You do have some hobbies when you are during your childhood, during your college days. You might be having some hobby or some interests. You again start doing that. So you start taking some time. ऐसा बोलते हैं खाली दिमाग शैतान का घर होता है. So keep yourself busy. Trying to keep yourself busy. Keeping yourself busy doesn't mean that you are working all the time. Household works are different, and giving time to your hobby is different. So do give some time to your hobbies. Okay. Then physical activity, exercise is very very important. Even in during pregnancy. During pregnancy, you should always do it under guidance. Whatever your doctor advises, you first ask your doctor whether I can take up some exercises or not. And again, once doctor tells you yes, you do it under trainer. So I would advise that you always do your exercises under trainer. Then yoga is very important, meditation is very important, music therapy is very important. It's upcoming these days. There are so many soothing music which is soothes you as well as to baby. It has an effect on the baby also. There are studies that those soothing music, if you listen to, they have a good impact on the baby. I'll just take a few more minutes. So, simple walking is important, yoga, pranayam, meditation, deep breathing is very important. Okay, deep breathing exercises are good to relax your mind, relax your nerves. Okay, then adequate rest is important. Uh, Few women they can't tell their feelings very openly. So those women, कुछ लोग बहुत अच्छे से बात कर पाते हैं, कुछ लोग नहीं कर पाते हैं. They can't tell their feelings very openly. उनको मेरी एडवाइस रहेगी कि वॉट एवर यू आर फीलिंग यू स्टार्ट राइटिंग डाउन वॉट एवर यू आर फीलिंग जस्ट राइट इट डाउन. Okay, that is again a sort of outlet. You require outlet. That is the main thing. That is what I am emphasizing again and again. So you need some outlet. So start writing. Start writing whatever your feelings. That will again help you if you're not very vocal about it. Then you can join some groups. There are so many groups these days. Join a group where all the pregnant females they can share their experiences on that platform, and you can speak about your feelings. Okay. Then tocophobia we call a fear of childbirth. Sometimes we hear that it's a very painful process. So that वो डर बैठ जाता है दिमाग में. Pregnancy हो गई, now it's going to be a very painful process. Delivery is a very painful process. So वो डर बैठ जाता है delivery का, उस pain का दर्द का डर बैठ जाता है. That is one of the reasons you feel anxious. So for that, my advice is you join ANC classes, antenatal classes. Most of the doctors are taking ANC classes these days. You enroll in those classes where you are guided properly. कही हुई बातें जो आपने सुनी हुई हैं और एक डॉक्टर जो आपको सही बात बताता है, there is a difference in that. So you will be guided properly how you are going to go into labor, how your labor will proceed, and how delivery takes place. So you join some ANC classes. Sometimes bad experiences you hear from your friends. मेरे डिलीवरी के टाइम पे ऐसा हो गया, मेरे घर पे ऐसा हो गया डिलीवरी के टाइम पे, वो भी एक फैक्टर होता है. तो ये सारी प्रॉब्लम्स आपकी सॉल्व हो जाएंगी अगर आप ANC classes join करते हैं. Lastly, I'll say never feel embarrassed about sharing your feelings to your doctor. Be very, very open with your doctor. Okay? And sooner you get the help, the better. It's better for you. ट्रीटमेंट बहुत इंडिविजुअल होता है. आपकी फ्रेंड डॉक्टर के पास गई थी, उसको डॉक्टर ने ये बताया था, उसको ये दवा दी थी. आपको कुछ हो रहा है, आप भी वही दवा ले सकते हैं क्या? नहीं, आप वो दवा नहीं ले सकते हैं, क्योंकि हर कोई इंडिविजुअल डिफरेंट होता है. आपकी फ्रेंड को जो दवा सूट हो गई है, जरूरी नहीं है आपको वो दवा सूट हो. उसकी बॉडी डिफरेंट है, उसके सिम्टम्स डिफरेंट हो सकते हैं. ओके, सो टेक होम पॉइंट फ्रॉम माय साइड विल बी दैट डिस्कशन, today's discussion का टेक होम पॉइंट मैं यही बोलूंगी that sharing your feeling is very important. Communication is the key to avoid all these problems. Okay, and to share your feelings with whoever you feel comfortable, on whoever is close to you. Don't bottle up your feelings. Okay, so don't worry and enjoy your pregnancy and motherhood. It's a very good phase in your life which comes once in a lifetime. Okay, so I'll advise you to enjoy your motherhood, enjoy the feeling. Okay, don't get anxious, don't be nervous. It's all a very natural process. Okay, and you can always follow me on Baby Chakra and let me know if you want to know something else, if you want to discuss some other topic with me. You are most welcome. I can always come back with some new topic to you. And regarding the questions, crying during pregnancy, Jenny is asking, does crying during pregnancy affect the baby? Of course. Crying is an expression of sadness. If you are crying out of joy, that's another issue. That's a good thing. Then it will make you light. But if you are crying because of some sad things, then that is definitely going to affect your baby. because as I told you, it does affect your baby. There are cases of low birth weight babies. IUGR, intragrowth uterine growth retardation, is very common. And then sometimes with excess tension, your BP might get raised. So to avoid all this, don't cry. If something is there which is bothering you, something is there you are not able to help at home, then please see your doctor. She'll suggest you whether you require a counselor or not. Few things are there which you can't help. You have to live in those circumstances. If that is the case, then how to keep yourself away from those tensions, that your counselor will tell you. Because not everything is in our hands. Sometimes we have to live in that atmosphere which is not very comfortable for us. So if you are crying because of all that, then you do need help, and you should try to avoid whatever is giving you pain. That is what you can do best, because you are doing this for your baby. Okay. Then Naina is asking, Preeti, can you take anxiety and depression medicines while pregnant? You can take. As I told you, mild cases, they don't require any medicines. They just require some reassurance and counseling. But severe cases do require some medicines which are given under the guidance of psychiatrist. So I always advise my patients, psychiatrist will change your medicines according to pregnancy. If you have been on psychiatric medicines since before pregnancy, then you might need to change few medicines. So psychiatrist will give you medicines according to pregnancy. Can arguing cause anxiety? I couldn't read that question. Can I read it again? Of course, arguing is never a healthy thing, and during pregnancy you should always avoid arguing. Avoid something. I would suggest you avoid something which is bothering you. That is the best thing you can do when you are pregnant, because you are going to take care of your baby first. It's a matter of these 9 months. Things are going to be there for lifelong, but these 9 months will not come back to you. So you have to keep away from all those things. Try to avoid those things. Distract your mind to some other things which you like. Listening to music, dancing, walking, some other things. Listen to some positive things like positive Shivani and all these people, Sadhguru. These people are giving you lectures on all these things, how to avoid anxiety, how to avoid depression. You can listen something which soothes you. Keep yourself distracted, because those things are going to stay. But these 9 months, you are not going to get it again. So I'll advise you to keep yourself free from all those things deliberately, and just think of your baby, your body, and positive things. Okay. दुर्गा सालवी इज आस्किंग, प्रेगनेंसी में डिप्रेशन से दूर कैसे रहा जाए? ज्यादातर प्रेग्नेंट वुमेन में ये प्रॉब्लम होती है. दैट इज व्हाई आई हैव टेकन दिस टॉपिक काउंसलिंग. Other than obs-gyne, my special interest is counseling. So I have done so many courses with counseling. So that is why I have taken up this subject. So many patients I am seeing, surge of patients with depression and anxiety. So अवॉइड करने का यही तरीका है जो मैंने अभी बताया आपको अपने आप को अलग रखना है इन सब बातों से. कुछ चीजें आप हेल्प कर सकते हैं, कुछ चीजें आप हेल्प नहीं कर सकते हैं, बिकॉज यू हैव टू स्टे देयर. कुछ चीजें आप हेल्प कर सकते हैं विद द हेल्प ऑफ योर पार्टनर. अ सपोर्टिव पार्टनर plays a big role in this. If your partner is supportive, then no matter what you're going through, you will sail through this period. आपका ये पूरा टाइम बहुत आराम से कट जाएगा. That is why I told you that if you listen to my lecture with your husbands, it's going to help. So if your partner is supportive, reassurance is the only thing you require. और अलग रहने के लिए, if it is not in your hands, like there are few circumstances at workplace, lot of stress if you are getting, then I would suggest you take some time off from your work. ओके. और अगर घर पे ऐसा है ज़्यादा ये प्रॉब्लम का, आई हैव ऑलरेडी टोल्ड यू दैट यू विल रिक्वायर टू कीप योरसेल्फ अवे. अगर ऐसी चीज़ है जो आप अवॉइड आप हेल्प नहीं कर सकते हैं, तो फिर आपको अपने आप को अलग रखना पड़ेगा उन चीज़ों से डेलिबरेटली. Ankita is asking, what can you take for panic attacks while pregnant? Panic attacks, what it will depend on what kind of panic attacks. As I told you, in symptoms, that sometimes there might be aggression. छोटी छोटी बातों पे आप बच्चों को मार देते हैं, छोटी बातों पे आप चिल्ला पड़ते हैं. इसको काम डाउन करने के लिए प्राणायाम इज वेरी हेल्पफुल. डीप ब्रीदिंग एक्सरसाइज इज वेरी हेल्पफुल. व्हेनेवर you feel that you are getting that panic attack, just sit there, take 10 deep breaths, and after that you think, is this thing is more important to me, or my baby is more important to me? Is this thing which is giving me tension is more important to me, or my baby and my health is more important to me? Any day your answer is going to be your baby and your health. So those things are not important. Those are small things which are giving you tension, unless it's a very big tension where you need to see a counselor. Most of the things, day to day tensions जो एक फैमिली में होते हैं, उनको आपको अवॉइड करना है. पैनिक अटैक के समय, as I told you, if you are doing regular yoga meditation, you can take these time. In these COVID times, lot of online platforms are there where you can join for doing yoga. If you don't know yourself, then do it under guidance, because there are few things which you can't do during pregnancy. Not all asanas, not all pranayams you can do during pregnancy. So I'll suggest you to do it under guidance. But deep breathing exercises everybody can do. Deep breathing itself gives you a very calming effect, and I would suggest you, there are so many CDs these days for calming music. Garbha sanskar is a very new thing coming up, which affects the baby. You get soothing music, soothing talks, all those things you get these days online as well as in CDs. You can distract your mind by listening to all that. Don't worry about anything during these 9 months. I'm telling you again and again, these 9 months you're not going to get again. So I think questions are over. Panic attacks you should try to avoid. And any other questions if you have? I don't think any other question is there. I don't think I have summarized. This is a very vast topic, but I have tried to summarize it in such a short period. If you want, if you demand, then I can again come back with few of your questions to answer it. And I think that's it. You all have a happy day, and happy motherhood to all of you. You can follow me on Baby Chakra any day, anytime. Okay? Namaste.